Hello, everybody. My name is Irina Bulakh, and today I want to introduce my team and introduce our presentation. Systematization of features and recommendation regarding architecture and urban planning and placement of university hospitals. In the civilized world, the state of development of the medical industry indicates the standard of the social life, the attitude of the health of citizens, or for the health of future generations. This phenomenon is caused by many factors, including environment pollution, lack of the gradual and timely architecture and urban modernization of the medical system, limited access to quality and modern health care, lack of the culture of healthy living, prevalence of the self-medication, untimely treatment and consequence, numerous chronic diseases. The only way out of this situation is to introduce step-by-step change without abrupt and cardinal instant updates, which in the approach provide a basic for more correct adaptation and coordination. Then studies in architecture and urban development of healthcare in the leading countries like United States, United Kingdom, Germany, France, as well as studies of success factors in leading countries of the medical field like Hong Kong, Singapore, and United Arab Emirates revealed a number of patterns and direction of development and organization, among which one of the most characteristic in the consolidation, polystructural, and multifunctional of the newest medical institution. Therefore, in the following context of the study have been attempted and introduced at the main design features of the university hospitals, which are the next evolutionary step in comparison with clinical hospitals. The close type of the post-Soviet medical institutions to university hospitals are clinical hospitals, where medical departments operate and where young doctors undergo internships. The example of clinical hospital are the Kiev Clinical Hospital number 8, the Dnipro Clinical Hospital number 9, the Minsk Clinical Hospital number 1, and the National Clinical Hospital located in Russia. The university hospital provides a complex combination of medical diagnostic, rehabilitation, training, research, and experiment functions, combines them and interacting is in one multifunctional complex located within the same territory or in different areas. University hospitals, as a rule, require state status and are designed to serve the population of the whole country without connection with the place of residence of the citizen. Based on those provisions, the capacity of the university hospital should be calculated at least 800 to 1,000 dependent beds. We've talked about historical experience of the university hospital design. The first of all is the university hospital Hamburg Pendorf, located in Hamburg, Germany. Next example is the University Medical Complex Freiburg, located in Germany. The Jonas Gaterburg University Medical Center, located in Mainz, Germany. Today, The architecture of healthcare facilities is gradually losing the features of the architectural shell for the technical organization of therapeutic process and itself acquires certain therapeutic preparation. One of the important trends is also the use of environmental design approach in the design of medical institution, which creates the basic for sustainable development of architecture in the field of the health care. And if talk about example, one of them is the Queen Elizabeth University Hospital, Glasgow, Scotland. Another example is University of Montreal Hospital Center, located in Montreal, Canada, and Koga University Hospital, located in Koga, Denmark. Today, the university hospital is one of the most promising and effective forms of organization of hospital structures. This is primarily due to the fact that the university hospital is a multifunctional medical institution which within the territorial boundaries of the one complex combines and synthesizes the interaction of a number of related functions. For example, multidisciplinary and specialized medical education and training, medical profile research and experimental production, as well as many ancillary services together create the conditional of for an emerging effect in the work of the hospital. It is possible to design university hospitals both in the new suburb area, free from the surrounding building and with a significant potential for landscaping of the medical complex. In this case, it is advisable to design a centralized building um, of the university hospital with a fairly extensive form of small and medium-sized building, which in case of future need will allow more freedom to expand the health care facility. In this case, when it is decided to create a university hospital in the existing urban environment on the basic of the expansion of an existing hospital or educational medical institution, it is advisable to design a centralized building with a combined volume of height and medium stories. The main conclusion is the understanding that each university hospital is a unique object and cannot be designed as a typical project. In each specific case, it is necessary to conduct a thorough project study regarding the task, goals, capabilities of the future hospital, the characteristic of the territory, the living population, etc. Thank you very much for your attention. Good luck and good day.